Fetal development and birth. The first trimester runs from fertilization to the end of the 3rd month. By the 9th week, the embryo is called a fetus. There's mainly organogenesis during this time, or development of the organs. Remember, genesis means the formation of, like spermatogenesis and oogenesis. This time it's formation of the organs. The sex develops, so we get formation of the male or female sex organs. The growing embryo and fetus is most susceptible to environmental factors at this time. Teratogens are substances that increase the chance of birth defects. The chorion secretes HCG, which stimulates the corpus luteum to secrete progesterone and estrogen. The critical phases of prenatal development are really the entire first trimester, but mainly the first 8 weeks of that time. We can see abnormalities of the neural tube happens during that time, so that's the brain and spinal cord, the heart, extremities, cleft lip, ears, eyes, tooth enamel, and genitals. Examples of teratogens include alcohol. FASD is 100% preventable. If you are pregnant or plan to become pregnant, don't drink any alcoholic beverage. There is no known safe level. FASD is used to describe a broad range of effects associated with alcohol use during pregnancy. The spectrum can include physical effects as well as effects on the brain that may result in problems with learning, emotions, and behavior. Tobacco. Smoking during pregnancy appears to raise the risk of miscarriage or premature labor. The primary danger is hindered fetal growth. Nicotine depresses the appetite at a time when a woman should be gaining weight, and smoking reduces the ability of the lungs to absorb oxygen. The fetus, deprived of sufficient nourishment and oxygen, may not grow as fast or as much as it should. Cannabis can damage the brain, the heart, and can cause the intestines to be outside the body. Folic acid is not a teratogen, but a lack of it causes spina bifida. Spina bifida is a birth defect that involves the incomplete development of the spinal cord or its coverings. The term spina bifida comes from Latin and means split or open spine. It occurs at the end of the first month of pregnancy when the 2 sides of the embryo spine fail to join together, leaving an open area. In some cases, the spinal cord or other membranes may push through this opening in the back. Folic acid is a B vitamin found in foods such as kale, spinach, orange juice, and enriched grains. Many studies have shown that women who get 400 micrograms daily prior to conception and during early pregnancy reduce the risk that their baby will be born with a serious neural tube defect. So Materna is the suggested vitamin during pregnancy and actually provides 0.6 milligrams of folic acid. Sexual development. Early on, males and females are exactly the same. What forms the glans penis in the males becomes the clitoris in the females. The penis shaft becomes the labia minor, and the scrotum becomes the labia major. The labia are the folds that surround the urethral and vaginal openings in a female. The male and female sex organs originate in the abdominal cavity. By the 3rd month of embryonic development, the genes on the sex chromosomes cause gonad tissue to specialize into testes or ovaries. The Y chromosome carries a gene called the sex-determining region Y, or SRY, that triggers the production of male hormones known as androgens. The presence of androgens starts the development of male sex organs in the fetus. Fetal ovarian secretions are not required for female sex differentiation. So this means without testosterone, whether the fetus is XY or XX, it will form with female genitalia. Second trimester, 4th to 6th month, lots of growth. The organs continue to form. Cartilage skeleton is replaced by bone. The fetus can survive outside the womb. The placenta secretes progesterone and estrogen. 3rd trimester, 7th to 9th month, more growth. The organ systems increase in size. Fat is deposited. The respiratory and circulatory systems allow for air breathing. Remember, in the respiratory system, the lipoproteins have to be put on the alveoli so they don't stick together. The testes descend into the scrotum. So size comparison in the first, second, and third trimester. By the 3rd month of pregnancy, a mother's bowels and organs get displaced due to the pregnancy. Notice how the fetus is taking out most of the room in the abdomen now and is pressing on the bladder and on the rectum. Birth is also known as parturition. How can I remember that, you ask? Parturition, this is how I remember it. The mom and baby part ways. Parturition. Happens 38 to 42 weeks from conception. It's due to low levels of progesterone. Remember, progesterone prevents contractions, so if it drops, it allows contractions to occur. High estrogen levels trigger oxytocin receptors in the myometrium. Rhythmic uterine contractions signal that labor has started. And cervix begins to dilate, which means it gets larger because the baby's head is coming down through the cervix. The amniotic membrane bursts, and this is called the water breaks. Parturition is a positive feedback loop. Hormones keep increasing until the baby is out. So it starts here, the head of the fetus pushes against the cervix, which stimulates by nerve impulses the brain, and by brain we mean the hypothalamus. Hypothalamus then stimulates the pituitary gland to secrete oxytocin, which is carried to the bloodstream, to the uterus, causing contractions, which causes the fetus's head to push against the cervix. So positive feedback loop until the fetus is out. The labor hormones have the acronym PROP, P-R-O-P. The first P is prostaglandins. It's a local area hormone produced by the uterus that works with oxytocin, causing uterine contractions. Relaxin is produced by the placenta. It relaxes ligaments in the pelvis to help ease the passage of the baby. Oxytocin is for contractions. And prolactin is produced by the anterior pituitary. It causes the mammary glands to produce milk. Let's look at the feedback loop. We're going to go right to the bottom first. The fetus's head pushes down, which causes cervical stretch. This stimulates the hypothalamus through nerve impulses to stimulate the posterior pituitary to release oxytocin, which causes more uterine contractions. Uterine contractions cause the uterus to produce prostaglandins, which again cause more uterine contractions. So positive feedback loop there. And then cervical stretch directly causes uterine contractions. So lots of positive feedback loops until that baby is out. The 3 stages of birth. The first stage is dilation or labor. It's the longest stage. It can last from 2 to 20 hours. During that time, the amniotic membrane bursts. Then the baby comes out, called expulsion or delivery. Following the baby's birth is the placental delivery, called the afterbirth. Placenta has to deliver usually within 15 minutes. Other than that, the mom could lose a lot of blood because there's a huge blood supply to the placenta. Okay, this is the real deal. There's graphic photos coming. If you don't want to see them, look away now. So we have the head crowning, head still coming out, and the head is out. So that's the hardest part. Then the rest of the body is malleable. It can move, so the shoulders are out. The body's coming out. Now the baby is out. They suction any water out of the mouth and nose to make sure there's no more fluid in the lungs. Then the placenta starts to deliver. Placenta's delivering. They clamp and then cut the umbilical cord. And the baby is wrapped up. So you can once again look at the video. It's all over. Okay, everyone out. Yay! I can't wait to see our new baby sister. Me too. I bet mommy had the most beautiful baby in the world. Yeah, beautifuler than that one. Yep, and that one, yep, and that one, yep, and that one, yep. Well, there she is. Well, nice try, Mom. They all look like that right after they're born. Okay, delivery methods. The natural or vaginal birth means the baby's coming through the vagina. As it does, it can cause tearing from the vagina to the anus. We don't want that to happen, so a doctor cuts off to the side to ensure there's not tearing right down to the anus. And that cut off to the side is called an episiotomy. Cesarean section can also be done where they cut through the abdomen and then take the baby out through the abdomen rather than through the vagina. This is done if babies are feet first, or for moms with STIs, because we know the baby can contract the STIs as coming through the vagina. The epidural is a needle. So here we have, first of all, this is freezing, and then they put in a bigger needle and leave this tube in the spine throughout the birthing process to provide anesthetic. So needle inserted into the epidural space in the spine. It provides pain relief during labor by blocking sensory pain receptors or the neural pathway. So it causes the woman to be numb or have less sensation from the waist down. Provides anesthesia for episiotomy or forceps delivery. It avoids slowed heart rate of baby and mom, which of course can be dangerous. Its use, I guess, remains controversial. I put this point in because students asked for what is the chance of paraplegia? It's 1 in 250,000 or 0.004% of becoming paralyzed as a result of having an epidural. Does your back hurt from playing with the kids? It's a guy thing. You wouldn't understand the level of pain. He said to the mother of his 3 large-headed children, "Always playing the childbirth card, aren't you, Wanda?"